September is Menopause Awareness Month, and while most women associate hot flashes and mood swings with menopause, there are other symptoms that postmenopausal women may be reluctant to talk about with their doctors. Joining us today to talk about what to expect and how to treat some of those uncomfortable symptoms of menopause is Dr. Lisa Masterson, former host on The Doctors and currently sharing her health and lifestyle information through her website, Health and Heals with Dr. Lisa. Doctor, what are some symptoms associated with menopause?
Well, menopause is a normal, natural event, and basically the definition is when you haven't had a period for a year. And as you know, a lot of the symptoms women know, like hot flashes, difficulty sleeping, mood disturbances, memory problems, vaginal dryness, feminine dryness is one of the issues that a lot of women don't know about, and then a lot of women know about weight gain as well.
Could you tell us some symptoms of postmenopausal?
Well, postmenopausal women is when those effects of the lack of the estrogen due to the ovaries not functioning as well, so it has an effect on the actual vaginal tissues. So vaginal dryness is a real big problem with women, and 1 in 3 women suffer from this problem. And it can cause pain during intercourse, what we call dyspareunia. That's the actual medical definition of it. And this is due to the effects of the estrogen on the vulvar and vaginal tissue, which causes thinning, dryness, and inflammation, and then causes pain during intercourse. And vulvovaginal atrophy is a real big problem that causes the pain during intercourse. And so women need to talk to their doctor about this because this is very common. 1 in 3 women will suffer from dyspareunia.
Doctor, how can we encourage women and their doctors to discuss pain during intimacy during their routine exams?
It may be difficult for them, but it's really important to discuss this with your doctor because there are a lot of options, and it's not like hot flashes where, you know, they'll eventually go away. Dyspareunia or vulvovaginal atrophy will actually get worse if you don't treat it. So it's really important that you talk to your doctor and get treatment.
Doctor, what can women do to treat their symptoms?
Well, in this discussion with their doctor can give them options like lubricants or moisturizers, but these are really temporary reliefs, and it doesn't actually treat the problem like the vulvovaginal atrophy or the problems going on with the tissue at the tissue level. So it's really important they talk to their doctor. There are medications out there, prescription medications like Osphena, which is the only FDA-approved once daily, hormone-free oral pill. A lot of women don't like to use, you know, messy vaginal applicators and things like that, so it's a really great option for women to use. But it is a prescription. She does need to talk to her doctor about it because it does have risks like cardiovascular disease and endometrial cancer, so it's important that she discuss this with her doctor. But there is treatment to keep it from getting worse, so it's important she have that discussion.
Doctor, is there anything you'd like to add?
If you want more information about Osphena, you should go to osphena.com because that's got not only a quiz that I've given so the women will know if this is an issue for them that they need to discuss with their doctor, but it gives also safety and other information about Osphena, which I'm happy to be here on behalf of Duchenet USA.
Doctor, I'd like to thank you for taking the time to talk with us today. Have a great day.
Thank you, you too.
You're welcome.